Hello guys, this is Lily, and welcome to my YouTube channel. This video is a script for massage therapy oral or practical examination for assessment 2. Room 4. Assessment 2. Guys, this is a script that may be helpful in your oral or practical examinations either in school or in your certification examination. You may use this script, but you can always make your own for your examination. This is just to give you an idea. Important tips for the oral or practical examination. First, you will be stationed outside the door for each room. You will be given 2 minutes to read the scenario or the problem of the client that you will do your assessment. During the 2 minutes time, you should already getting ready of your script, and all the assessments you will need to do in order for you to be able to come up with your critical impression on the client's presenting condition within 10 minutes allotted time while you are inside the room. Take note guys, make use of the 2 minutes time given to read the scenario while you are still outside the door, to prepare your script and what you are going to do in the assessment of your client's presenting condition. Upon getting inside the room. Hello everyone, good morning or afternoon. This greeting will be addressed to all your client and the CMTO examiners. Then, proceed to the examiners right away with a sweet smile to get your name scanned. Then, proceed to the sanitizer to sanitize your hands and elbows before you start facing your client. I'm gonna blank wash or sanitize my hands and elbows for 10 seconds. Upon facing your client. Hello there, or good morning, or afternoon, my name is. State your name. Your therapist for today. How are you? Wait for client to answer. Are you comfortable in your position right now? Wait for client to answer, yes. Ask this question right away to the client for client care. I see in your file that you have some discomfort or condition in your blank area. State the problem area based on the scenario. Is that right? Can you point it to me? For this condition, I'm going to conduct some assessments on you to determine the nature of your presenting condition. I will be performing some palpation and observation, range of motion, special tests, neurological tests to have a better understanding of your presenting condition, and come up with a clinical impression in order for me to devise an effective treatment plan. During the tests, I may touch you or move you in certain positions. Is that okay with you? Wait for the client to answer, yes. If you feel any pain or discomfort at any time, please let me know and I will stop immediately. For your safety, I will be standing beside you at all times to support you. I will be looking for any positive or negative result in all tests. Do you understand everything? Do you have any questions? May I start the assessment now? Guys, you need to study these tests in order for you to be able to come up with your clinical impression on your client's presenting condition. In the assessment room, you will be given a case scenario where you will be performing various tests to help you come up with your clinical impression. The following tests are arranged for an easy assessment of your client's presenting condition. Palpation of anatomical structures. Range of motion. Orthopedic tests. Myotome. Dermatome. Tenel sign. Deep tendon reflex. First, do the palpation of the anatomical structures, which are the area directly affected and where your client feels pain and discomfort. While performing palpation on each area, you ask the client this. Any pain or discomfort? You will ask this question to determine which area the client has pain or discomfort. This will help you assess which area you will focus on to do the next set of tests. Next, is the range of motion, AROM, PROM, RROM. For these tests, you will need to know how to direct your client to do the tests. This will help you assess if the affected painful area as the result of the palpation assessment be confirmed that you are on the right track in finding your clinical impression on your client's presenting condition. Next, is the orthopedic tests. You will be performing at least 3 special tests important to detect or assess the client's condition. For the special tests, you will need 2 tests with a positive result and 1 test with a negative result for rule out. For example, if the client has a tennis elbow problem, then you will need to do 2 special tests that will confirm a positive tennis elbow problem and 1 test that will cater on testing the other adjacent areas, such as a test for a golfer's elbow problem to confirm for a negative result for rule-out purposes only. It is very important, guys, to make sure that you will not run out of time before your 10 minutes time is over. You need to state your clinical impression right away after performing all the special tests. With the palpation, range of motion and the special tests results, you already have an idea of what your client's presenting problem is. When you still have time, then perform the myotome and the dermatome tests just to confirm more of your clinical impression on your client's presenting condition. If you run out of time, the palpation, range of motion, and the special tests that you have performed are good enough for as long as you get the correct results of the tests you performed. Just make sure you study all the tests, including the Tenel sign and the deep tendon reflex, in case you need to perform these tests. There are 3 types of range of motion: the active range of motion, passive range of motion, and the resisted range of motion. For the shoulder range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The shoulder movements are flexion, extension, abduction, adduction, horizontal abduction, horizontal adduction, internal or medial rotation, external or lateral rotation. For the neck range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The neck movements are flexion, extension, lateral flexion, rotation. For the elbow range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The elbow movements are flexion, extension, pronation, supination. For the lumbar range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The lumbar movements are flexion, extension, lateral flexion, rotation. The hip movements are. For the elbow range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The hip movements are flexion, extension, abduction, adduction, internal or medial rotation, external or lateral rotation. For the knee range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The knee movements are plantar flexion, dorsiflexion, eversion, inversion, supination, pronation. For the ankle range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The ankle movements are flexion, extension, internal or medial rotation, external or lateral rotation. This script may be helpful for the oral or practical examination. The first test I'm going to do is the active range of motion of your blank joint. State the joint area being tested. The purpose of this test is to check if there's any limitation in the movement of your blank joint. State the name of the joint. For example, the shoulder joint. I will show you how to do the movement, just copy what I do. You will be doing all the movements by yourself without my assistance. Do you understand everything? Do you have any questions? The first next test I'm going to do is the passive range of motion of your blank joint. State the joint area being tested. The purpose of this test is to check if there's any limitation in the movement of your blank joint. State the joint, for example, shoulder joint. I will be the one doing the movement for you without your assistance. Just fully relax your muscles. At the end of the range, I will apply overpressure to find the end feel. Do you understand everything? Do you have any questions? The next test I'm going to do is the resisted range of motion of your blank joint. State the joint area being tested. The purpose of this test is to assess for the strength and the ability of the muscles and other structures surrounding the joint to facilitate movement. I will be asking you to do the movement against my resistance and holding it for 5 seconds. Do you understand everything? Do you have any questions? Start asking the client to perform the ROUGE. Please bring your arm up towards the ceiling on abduction. For example, show the movement against my resistance and hold it for 5 seconds. Any pain or discomfort? Ask this question while doing the movement. Are you comfortable? Ask this question while doing the movement. And relax. Asking the client to relax after the movement. The strength of the muscle is, state the great example, 5/5, there's no weakness or shakiness while doing the movement. I'm going to do some orthopedic tests to help me come up with a clinical impression of your presenting condition. The first test I'm gonna do is, state the name of the test example, painful arc test. The purpose of this test is to assess for, state the purpose of the test. I would like you to blank, state the position, stand or sit on this chair or table or lie down on your back or on your abdomen on the table. I will stand in front of you, position of the therapist. Explain how you will perform the test. Are you comfortable? Asking for client's comfort. Any pain or discomfort. Asking the client from time to time while performing the test, it's client care. The result of this test is negative. No need to explain why negative. It should have been positive if you felt blank, state the positive result of the test. The next test I'm going to do are some neurological tests, which include dermatome, myotome, Tenel sign, deep tendon reflex. Now, I will perform some neurological tests to assess your neurological responses. First, I will perform the dermatome test of your blank, state the area where you will be conducting the test. Is that okay with you? Dermatome test is to assess the normal skin sensation of a muscle or group of muscles that is supplied by a single nerve root from the spinal cord. I will be using a cotton ball to perform the test. Please let me know how you feel. Is it okay to touch you here? Show the area where you will be performing the test. Please close your eyes. It is important that the client's eyes are closed while performing this test. Perform the dermatome test by asking, do you feel this? Asking this question while gently rubbing the cotton ball on the area first tested. Do you feel the same? Asking this question as you continue to rub each area with the cotton ball until all areas has been tested. Are you comfortable? For client comfort after doing the test. Once you are done performing the test, give the result. The test is negative. If the result of the test is negative, no need to explain a negative test result. Then, explain this, very important. It should have been positive if you felt numbness, tingling sensation while doing the test. If the result of the test is positive, then give the reason right away why it is positive. Positive test based on the client's presenting condition. The myotome test. The next test I will perform is myotome test, which is to assess the strength of a muscle or group of muscles that is supplied by a single nerve root coming from the spinal cord. I'm gonna show you a specific movement, just follow what I do. Then I will apply resistance on your muscle, I will hold it for 5 seconds. This is to check for any weakness or shakiness on your muscle. Please blank, ask client to sit down or stand up or lie down. This is the client's position. Are you comfortable? Very important for client's comfort. Please do this movement. Show client the movement. Please make sure that the client does the movement properly. Is it okay to touch you here? Show client the area. Asking permission to touch the client. Then apply pressure on the muscle being tested, hold it for 5 seconds. Check for any weakness or shakiness while doing this test. Any pain or discomfort. Ask this question while doing the test, very important. Are you comfortable? Very important to ask for client care. Now ask the client to relax. Are you okay? Very important to ask for client care. Then give the result of the test. The strength of your muscle is a grade of blank, example, 5/5, which is normal. There was no weakness or shakiness during the movement. The Tenel sign test. Please take a sit here on this table, or chair if available. Are you comfortable? Please ask this question right away, very important for client care. The next test I will do is Tenel sign of your blank, state the area of the nerve being tested. The purpose of this test is to assess for nerve compression, paresthesia, neuroma, or any neurological signs such as numbness, tingling, pins and needles, sharp, shooting pain. Do you understand everything? Do you have any questions? I'm going to do a Tenel sign test on this area to test your blank, state the name of the nerve. Then find the area. Is it okay to touch you here? Ask this to get permission from the client for client care. Once the client said yes, then say thank you. I will tap this area 2 times using my 2 fingers. Tap the area twice and check for results. Any pain or discomfort? Ask this question while doing the test. Are you comfortable? Very important client care. Then give the result of the test. The result of this test is negative. If the result is negative, no need to explain a negative test result. Just say, it should have been positive for nerve compression if you felt numbness and tingling sensation on the area. Or, say, it should have been positive for neuroma if you felt pain on the area due to abnormal tissue growth. Ask the client to sit on the massage table or a chair if available, every time you start a test. Are you comfortable? Very important client care before you start the test. Then start your script for the test. The next assessment I'm going to do is deep tendon reflex of your blank, name the tendon being tested. The purpose of this test is to check for the normal reflex sensation of the tendon of your blank, name the muscle. I will be using a reflex hammer to do the test. Position yourself in front of the client getting ready for the test. Is it okay to touch you here? Please ask permission before you touch the area being tested. Then, when you get the permission, say, thank you. The reflex movement should be this blank, show the reflex movement you are looking for the test to the client. Then say, please relax, and close your eyes. Do the deep tendon reflex test. Repeat once again if needed. Any pain or discomfort? Ask this question while doing the test, very important. Are you comfortable? Very important to ask this for client care. Once done doing the test, give the result. Say, the result of this test is blank, example, grade 2, which is normal reflex response. For your finishing statement, you can say, so, we are done with all our assessments for today. Thank you for your time. I will be just outside the door to wash my hands. I will see you next to discuss your treatment plan. This will be the end of your 10 minutes massage oral or practical examination. You just have to wait inside the room until you hear the ring of the bell. Please make sure you finish all the assessments within 10 minutes of your time. Important reminder. Before you take your examinations, please make sure to practice more to finish within 10 minutes of your time. Response.